Hello, I hope you're well and having a fabulous day. We are going to have a check-in with these muscles at the back of the neck and the shoulder today. They can get so tight for a plethora of reasons. And when it comes to stretching the neck, I'm a little bit prescriptive on those because we've got some really important anatomy in our neck that we need to be mindful of and not overstretch. So one of the things I recommend is a spiky massage ball. These things are great, but they can be a little bit tricky to position correctly. And one of the things that I hear a lot from patients that are using these to access this muscle, particularly trapezius, is it can slide down the wall. So I thought I'd just drop in and show you how I do this. So what you might see or do is this type of positioning where you're quite close to the wall in terms of your body and then rolling that around. That ball behind you. And what can happen is that ball can sneak up, can you see? All right, so what I tend to do is stand further away from the wall. So I'm really leaning in, place the ball with my other hand in those lower fibers. So I really change my angle here and really leaning back into the wall. You do need some nice healthy knees, but then you can just gently squat down. So you're getting some nice quadricep strengthening work here, but that ball is then going up into those muscles and then down. And the good thing with this is you can alter your pressure as well. So if you're thinking I really need some work into there, you can lean really quite firmly, or you can just bring the body back away if you think I don't want that much pressure. So we can go longitudinally up those fibers, so lengthwise up the muscle. And the other thing we can do is a horizontal movement like so. So cross fiber, and that can feel really nice as well. So you're just gently taking the body side to side. And if you find a spot where you think, yep, that feels like it, you might choose just to hold that, perhaps for 10, 20 seconds. And let's just say you start that point, that pressure point, and it's maybe a 6 out of 10 on the discomfort scale. Hopefully that starts to drop down to a 3. And then we can just bring our body back up and into a nice standing position. Obviously what you do to one side, you do to the other. I wouldn't recommend using these every day. You can over-treat and potentially bruise the muscle. So maybe 2-3 times a week, giving some days in between use of. So I hope that helps with the spiky massage ball and just getting into this trapezius muscle. It's a really effective way to treat it for yourself. If you've got any other questions, please do get in touch. In terms of the size, this is the medium one. You don't want anything too big. That wouldn't be particularly useful. And the really small ones, they're great for the soles of the foot, but for this muscle, just not quite big enough. So medium one, spot on. As always, I wish you a very happy, healthy day.